So this is going to kick off our 2022 podcast. Dave, are we on?
We are on. So let's share about why we're doing our table talk this way, George.
Well, with the recent increase in testing, we've had an increase in our COVID numbers have gone up. So the clinic has taken more precautions, and we've decided to go virtual. And if somebody has a better way of putting it, please chime in. We're doing this for now. It wasn't what our plan was, but we decided that this was going to be the best route going forward, and we will reevaluate next month. So we are actually excited about this. This is actually pretty cool. We could actually include more people. We're able to get the star of the show, Marissa, back on. So that was a plus, right? So, yeah, we'll see how it goes. Different places, different faces, and different places.
Oh, man, that should be a new slogan.
I should copyright that.
Copyright that. And today's talk, we're going to be talking about wellness.
Yeah. With New Year's comes what, Art?
So we always want to set goals, our new resolution, turn over a new leaf. And I mean, not only us, but everybody in general, right? So our goals this year, or our topic is, how do we stick on them, right? How can we stay on track for a healthy 2022?
Yeah, I think
I know George talked a little bit about a different format, but we're the first not podcast, the first table talk of 2022. You have the whole PI team back on the table. We're all here, but we're all being safe and keeping following our policy and procedures. So we're moving forward with our talks.
And that's exciting because I think we learned from last year with this platform, and we got a lot of stuff that we can do moving forward, especially if we're going virtual. With that being said, we have some very special guests joining us. With the new year and the new me and the resolutions, we thought, what better way to kick our 2022 table talks off with some really important people at IHC. We have Wyatt and Misty. Are they here today? There they are. Hey, Misty.
Good morning.
Hi, good morning.
Hey, good morning, guys.
Good morning. So I'll let you guys introduce yourself. Let me first say thank you guys for taking the time and working this virtual world with us. This is all new to us too, and it's a pleasure to see you guys. Misty, can you introduce yourself first, and then Wyatt, you can follow?
Okay. Yes, absolutely. Good morning. I'm Misty Faulkner. I'm the registered dietitian nutritionist here at IHC. Happy to be here. Welcome, everyone. Happy New Year.
Hey, everyone. I'm Wyatt. I'm the exercise specialist here at IHC. I oversee the gym, and I take on all exercise programming here.
Thank you, guys.
We're fortunate. I didn't think we were going to get both of you guys in the same room, but hey, here we are.
Wyatt and I work closely together, so we're kind of nutrition and fitness are kind of a package deal, right?
What do you mean?
We Wyatt and I are part of the diabetes team, so that's our main focus here at the clinic. But we also, collaborate on patients. We share, plans with them and go over everything together because it's kind of, like I said, it's a package deal. If you just do exercise, you probably won't get the results that you want. And if you just focus on nutrition, again, you probably won't get the results that you want. But you need both of those to make a balanced life. It's kind of like the 4 medicine wheel, but it's a holistic approach. So you would need exercise, nutrition, spirituality, and other things to kind of make everything whole and complete. And so we work really close together and have a good system going.
Yeah, Misty, you seem like you've done this virtual stuff before. You're actually really good. Do you do sessions virtually? Are you familiar virtual?
I do have some sessions that I do virtually. We've done our Healthy Weight for Life class. Last year we had to go virtual because of, COVID, but we've done virtual events, Wyatt and I have. So.
Are appointments with you available virtually?
Yes, appointments are available with me virtually. I also can do telephone visits,
Okay.
and then I am still seeing patients in person in the clinic.
Okay, so you are absolutely available.
Absolutely. I'm
And
here.
Misty, do they have to go through their physician to get to you first, or how does that work?
So usually that's the recommendation, is that they go through their provider. They do send up the referral for me, and then I get a list of those referrals, and then either the patient can contact me to schedule an appointment, or I also can call referrals to get them scheduled. But also I have people that just call the phone or swing by my office and make appointments too. So in-person appointments are fine, telephone or referral. Those are kind of the three main ways of getting appointments with me.
And what about Wyatt? What about you?
Yeah, similar thing to Misty here is if it's pretty good, a recommendation to get cleared by your provider ahead of time to make sure you're okay to probably start an exercise program. But if you're someone who has, generally good health, you can schedule right away with me. You can call my extension. You can call the clinic, and they can point you in the direction towards me.
And we are so high tech in 2022. Can you see the ticker down there?
See it right there. Yeah.
You see the ticker? Dave, props to Dave on the 1s and 2s. Dave, good job. Thank you for that. But yeah, your guys' numbers down there, correct?
Yes.
Correct.
Oh, that's good.
So I have a question for the team. Is it only because you said you work on a diabetes team? Is it only for diabetes patients, or to somebody that has a primary outside of IC, can they come and visit you guys?
So we're open to everyone in the clinic. The grant that we work under is the SDPI grant. And so that is mainly geared for prevention and delay of diabetes, but also for helping manage diabetes. So that's our main goal here at the clinic. But yes, we see everybody. We don't exclude anybody. Everyone needs nutrition assistance. So.
Absolutely, especially with the new year coming. I know that we have been talking about goal setting and what that looks like. Obviously, a lot of people want to eat better and get a little more exercise in when the new year comes, and I think that's primarily the goal of individuals coming into the new year. Do you see that a lot?
Absolutely. Yeah, it's usually, COVID's kind of running a lot longer than I think many of us planned. And so with that, it's kind of time to start focusing on ourselves, getting some healing within our families and getting our health back on track. So one of those ways is, setting a nutrition goal and following that and just kind of having something better to focus on. I think having your energy into something that's positive, thinking about yourself and helping yourself grow as a person.
Yeah, that's good, especially with all the challenging things that we've been going through, especially with COVID situation.
Mm-hmm.
It's been very challenging to try to even get in a gym. At one point they were closed, and nobody could get into them. And I seen a lot of increase in people buying gym stuff because at one point I tried to go get some dumbbells from the store, and they didn't exist. They didn't even know when they were coming back to purchase them.
Yeah,
so that's good.
Absolutely. With this current climate we're in with COVID, it's very important to be creative in ways that you exercise or engage in physical activity. Some people might not have access to gyms. Here at IHC, we're very lucky because our gym is open to the community if they would like to use it. But like you said, you have to get creative and build walking routines or maybe get exercise equipment to do home exercise. So.
It's funny that you mentioned that. First, hey, Donna, Happy New Year. We got you in the chat there. Thanks for joining us. But, I was talking to Art earlier how many people that we see regularly that have never been to the gym, don't know we have a gym, never been to the gym, and then come to the gym, and then they hit us up and they're like, "Man, you guys got a gym down there? Pretty good gym. Like, how do I get in there?" You know, once people realize that we have it, they're like totally enlightened, and we have a full blown gym, right?
Yeah, we have a full-blown gym. We're very fortunate here at IHC because we actually have our own budget for the gym. So James Siva, he's the gym attendant there. He does a really good job of getting new equipment every year with the budget we have. So if you go in, you know, last year, it might look different to what it looks like this year. So we have new lifting machines, we have new row machines, we have new ellipticals, all great stuff too, especially if you want to get started and check it out.
I know I have some questions for some clients about doing gym workouts at home. Is that still an option for clients if they would like?
Yes, just like Misty, I use the same virtual platform. So if a client, employee, patient would want to get scheduled with me, we can set up an appointment and do a virtual. I can do a virtual, you know, workout here. I have enough space in my office where we could set something up, you know, over video talk. So it's up to their discretion.
Wow, a personal trainer at home on virtual, huh?
Yeah, right from your phone, right from your computer. You got it.
Heck yeah, nice. That's cool.
Yeah. There's so much to ask. I know we only have a short period of time, so there's some ideas that we wanted to talk about, but anybody got any questions for Misty? Or Misty, is there anything you'd like to share? Do you guys got any programs coming up, activities? Let's get the important stuff out, because I think we could probably spend all day with you guys on here. Is there any plugs you guys need to get in, any events, activities, or anything going on?
In probably March, we'll be starting our Healthy Weight for Life series. So that'll take place the first Wednesday of March, which is March 2nd. And that class is from 10 to 11, because we held it back a little bit because of the spike with COVID. But we are planning on doing that in person, depending on, again, what's going on with COVID. But that'll be here at the clinic. And that class runs from 10 to about 11. And you get nutrition education. So we have a topic that we discuss, and this is an 8-week program. And we also have Wyatt. He'll lead us in exercise. He covers the exercise portion. And then we have Lorelei, who does the cooking. So she'll do a cooking demo. They'll learn how to make a healthy meal that goes along the line of weight loss and managing blood sugar, whether you have diabetes or not. And it's a great class. It gives you some basic tools that you can take with you and then make it your own. And then that way you can achieve your goals. And it's a great class, but it usually runs 8 weeks. So we'll have it March and April of this year is when we're planning on starting it. And like I said, you have access to all 4 of us. We also have our nurse on hand. So we have a nurse that specializes with diabetes. So he's part of our team too. There's 4 of us, and he will also be there to cover medication questions or concerns. And it's just a good time. People really enjoy it. We usually have one session here at the clinic, and then the other session we usually have out on the farm, out at the Palma Solidarity Farm. That's a really great time because patients get to go out and pick their own produce, wash it. We prepare a meal together, and it's just a real casual environment, walking around the farm, feeling that fresh air, touching your food. So it's really important for you to get out there, touch your food. You know, if you're just eating out all the time, you kind of lose that connection, right, with your food. So if you're actually touching it, even if you're not growing it, but you're picking it up, smelling it, getting the hormones going, getting all that, you know, that the saliva going in your mouth, so you know your body's ready to eat. All these things are really important for long-term nutrition. And so that's kind of part of we really like to focus on that on the farm. The farm has a different experience, but just so people can get in there and not be afraid to cook in the kitchen and really take their nutrition and their health into their own hands. So that's kind of what we have coming up.
Yeah, thanks for mentioning Lorelei. We love Lorelei. There's actually some videos that have been shared on our YouTube, I think Facebook, and some of our social media platforms where she's getting down in the kitchen, right?
Absolutely. And so most of our recipes that we do here, we always give alternatives. If you're looking for a lower carb meal, we always give alternatives to that. But just making fresh ingredients, simple ingredients, or reusing things that you have in the home, we like to do those types of things because everyone's on a budget to some form, right? So most of us don't have just some huge disposable income where we can just buy whatever. So reusing our food, learning how to make something tasty, but also that fits with our nutrition goals. Those are really important. So we want to make sure that we're getting that out to the community so that they can have those skills in their hand and then pass that on to their children and their children. That's the point of the Healthy Weight for Life class.
We had a question from one of the audience members. It says, that all sounds fun and interesting. Is there anything for people that work?
So right now, because the clinic hours, we close at 4:30. So right now we do not have anything after hours. Maybe in the future, once we reopen, to more hours. But as of now, no, we've talked a little bit about maybe doing something virtual, but not quite sure. So, but as of now, the only thing we have are in-person, Monday through Friday classes.
Well, so some of Lorelai's cooking's online, right? On YouTube. I think we just shared the plug down there.
Right.
Yeah,
She does do she's doing those once a month.
Once a month.
Once a month, she's doing her cooking demos. And then, you'll have access to it anytime once it's been posted. And then you can, buy your ingredients, cook along with Lorelai, make those fresh food items. But yes, if they're, like I said, later on in the future, hopefully, we'll be able to address people who work. But for now, it's just a Monday through Friday, and we close at 4:30.
And then Misty, you do a meal plan after they come see you, and you identify what they need, and you can kind of get their refrigerator ready for a meal plan. How long does that? Do you do like a month meal plans, or do you do a 90-day meal plan, depending on the individual?
Right, I can do that. Depends on, if you have special dietary needs, I can make a plan for that. Some people just come in looking for breakfast. They want to eat breakfast every morning, but they're not quite sure, what they want to make. So I can do that. Some people want, lunch and dinner. Everyone wants different things, but I can make them for a week, for one day, for a month. Some people just want a sample just so they can kind of see what they're looking for in their meal plan. I can do meal prep. We can go over that. Healthy Weight for Life also helps with meal prep. You kind of learn how to prep your meals and then how to reuse those meals. So the sky's the limit when it comes to meal plans. I can pretty much do any kind of meal plan, and for whatever length of time that you're looking for. My meal plans include a shopping list. So you'll get a shopping list, you'll get recipes that are in the meal plan. They're usually quick and simple recipes, nothing fancy schmancy, just something simple. And you have that nice little package to kind of get you started.
Hey, Misty, you want to hear something just outrageous?
What's that?
We started our podcast series, and Jason was talking about eating a burger with no bun.
Okay, keeping it low carb.
Okay, so that doesn't sound outrageous to you?
It does.
Ms. Misty, I have a question. Could you talk a little bit about, I guess the biggest fear about coming to talk to a nutritionist or coming to see Wyatt is because they're going to tell me, I can't eat this, I can't do this, you should be doing this. Could you talk a little bit about how you work with your clients, and how you work around them?
Sure. I'm sort of I guess my nutrition philosophy is most foods can fit, or everything can fit. I don't tell people what they can and can't eat, because that's not what usually works. So what I do is I kind of go over the plate method is my main way of talking about nutrition, and then building on that and customizing that plate method to fit your needs and your family and your lifestyle. And so I work with that so that we can fit those foods in that you really want. And it's also about, what results are you trying to get? Are you just trying to get more vegetables in your diet? Are you trying to, lower your carbs? It just depends on what your goals and what your motivation is. And you can really make most things fit. You just have to plan for that. And that's part of the issue too. A lot of people, we're working or we're busy, and we we often don't plan, but you don't have to plan everything at once. Maybe even the night before, you're just chopping up those bell peppers to use the next day in your stir fry. So that way, when you get home, everything's chopped and ready to go. It's just about those small little changes that really add up to big wins and make your lifestyle improve by just doing those little things. So I'm not here to tell you what you can and can't do. You're grown, right? We're all grown. So no one wants that. And I don't want nutrition to be stressful. When nutrition is stressful, then you're not able to follow it for a lifestyle change. I want your nutrition to be a lifestyle change, not just a diet. So I don't promote telling you what you can and can't do.
Cool. Mr. Wyatt, the same goes with you. I mean, do I need to come to a gym to get the physical activity? Can you help somebody set up a plan that works around their schedule?
Yeah, absolutely. When you meet with someone, you never want to give them too much information or overanalyze what they're doing. It's always good when you have those one-on-one sessions to maybe give them one little tidbit, a little bit of advice that they can take home with them and hopefully build, a routine or have a habit for weeks to come. So when you come in and work with me, I might help you just with your form, and we focus on your form for 2 to 3 months, and then that's the thing we focus on until you're able to transition and do full body movements or other exercise to elevate your level of fitness. So those type of things, they take time and they take a lot of determination from both parties to really succeed.
Yeah, because if you try to go in the gym and lift as much as you can, not lifting it the last 3 or 4 years, boy, you're gonna feel that. That's for sure.
Yeah, absolutely. If you haven't been working out in a long time and you think, this is easy, I can get right back into it, that increases the risk of possibly having an injury. So it's definitely good to consult with me or check in. And maybe if you've worked out before, but you want some just quick tidbits, some advice, that's where I'm here to help out.
If somebody's in the gym, are you around? Are you available to see them if they have a technique question or need some ideas, or is that something you're only available for an appointment?
Absolutely. So I'm right next door to the gym. So if anybody at any time has a question, they're more than welcome to come knock on my door. James is also available. He can Teams me, or he can maybe answer the question on the spot and help out whoever is involved.
So we got a few more minutes. Part of where our discussions ended with our podcasting, I think, could be maybe somewhere, maybe if you guys would agree, you guys could send us off with is some positive affirmation and because a lot of goal setting and get these life changes, if we're not mentally ready, or if we're not positive with ourselves, it's really like walking through a big brick wall. Do you guys have positive affirmations to leave us? Do you have some motivation to give us?
I just want to leave you maybe with a couple of things. First of all, if you're, part of setting goal setting is really to recognize a need for change, right? So you want to make sure that it's really something that you really want to change. And if you do decide there's something that you want to change as far as eating habits go, then maybe you just pick 1 or 2 tasks. You don't, start changing all kinds of, different eating habits all at one time, right? So you might pick 1 or 2 goals. For instance, stop eating, you want to stop eating junk food late at night. Okay, well, maybe you set that goal and saying something along the lines of, I'm going to eat junk food 3 nights a week instead of eating junk food 7 nights a week. That sort of thing. So you set, you give a number to it. You want to quantify it, give a number to it. So once you give that number to it, then maybe you write it down, and then you work on that. And so maybe the 4 nights you did really, eat junk food, and then maybe those 3 nights you didn't. And so those are little wins, right? And you just slowly work on it each night. And maybe you need to decide, do I need someone else to help me achieve my goals? So you want to make sure that you're looking into that too. Do I need other people to help hold me accountable, or to help me keep me on track? So I would just say, pick 1 or 2 tasks, don't beat yourself over it if you end up, caving in, if you want to call it that, or whatever whatever term you want to use. Don't beat yourself over it. Nutrition can be stressful, and we don't want it to be stressful, right? So we don't want to move back. We always want to move forward. Always look forward. If something happens, just get back on track that day or the next meal or the next day. It's not the end of the world. Okay. So just remember that you have the power and that you're gonna be able to achieve your goals. You just have to take it one step at a time, and don't look back. Always look forward.
And speaking of positive
like
affirmations, we got an IHC or a shout out from a Paulette. Says, "Hello IHC. Thank you for always being there for me during my journey. Wyatt has helped me many times in the past. I still use his information today. Misty is a great help. Also, thank you for all the help. I am very grateful."
Oh,
Yeah.
man.
Thank you, Paulette.
Oh,
Yeah, thank you,
man.
Paulette. We appreciate that.
That's cool.
I just had two things I was going to leave for everybody. Just two mottos I kind of go by. Is the first one is very simple. It's progress over perfection. So that progress looks different for everybody. You're never going to be perfect. Don't even try to be perfect. And too many times, at least in today's society, we get, caught up comparing ourselves to other people. Yet our progress and what we do in our own lives is different from everybody else. The only person that can really know what progress we're making is ourselves. So really focus on more so the journey and the progress and the little steps you take. Don't worry too much about making things perfect or have to get it right out the bat and make it your own. And then my second thing is that I always stick by, Misty knows this, is motion is lotion. So motion is very important, and it will lubricate your joints. It will make you healthier over time, the more active you are, especially later on in life. So those are the two things I wanted to finish up with for you guys.
So you encourage our seniors and our elders and even people in wheelchairs, you encourage them to be active?
Absolutely. I think, there's a lot of research that can be shown that, the more active you are, the better for brain functioning and for your full body, especially when you get older. So.
Also aids in digestion. So for our elders, want to make sure that, the digestive system is moving and, things are going through, because a lot of times as we age, our digestive system slows. So in order to keep that going, exercise and moving around or walking around, even if you're just, walking in a small space, to get things going.
Awesome. We have
about we were missing. We talked a little about Lorelai, but we should have had her on. She could have been cooking for the team, right?
Oh yeah,
we could have had a lot of people. It's a whole
big part of the team,
right?
Yeah.
Right. I've seen her transition from showing people how to cook things completely different. Lorelai, we're shouting out to you. We didn't forget about you. We're always thinking of you.
No, we could have brought a lot of people on. Like it starts with our healthcare providers. You got to be forthcoming, and if you trust your healthcare provider, they can get you to Wyatt or Misty or Lorelai. I mean, a lot of us aren't familiar with the services at the clinic, so your healthcare provider is really the only person you're going to see.
Mm-hmm.
Yeah, so we have about 1 minute left. We just want everybody to know in the community, use the resources that we have here. Misty's available. You can get a hold of her. Her phone number, the phone number here for her is on the below there. You can get a hold of Wyatt or any one of us. You can always get a hold of us. We can always plug you in with them. And don't wait till it's too late. Don't wait till it's too late. When you're really, really in pain. I mean, I'm even speaking to myself, right now, and I got some changes that I'm slowly trying to make, life changes within myself. But don't wait. Come use the resources that you have with us.
I also like Misty's the way she put it. Take little steps, right? If you want to stay on track, one little step at a time.
Absolutely. That's going to give you the most long-term benefit.
Right.
So, Marissa, you want to close this out?
Yes. Thank you all for you guys joining us. stay tuned for our podcast that we'll be having coming up in the next couple weeks. Setting that we have.
Yeah, thank you, Wyatt. Thank you, Misty, for being on with us. We appreciate the information you got out to the community. I'm sure with this video, we're going to probably see a lot more people coming down to see you guys.
This is an awesome setup.
Yeah, thank you guys for having us. We appreciate it.
Thank you guys.
Thank you.
you.